I'm Dr. Saunders. This is an educational video on liposuction. Liposuction is the process of removing excess and unwanted fat. It's done to particular areas where we don't want the fat. The most classic areas are the stomach, the love handles, the thighs, underneath the neck or the chin area, and the arms. Liposculpturing is the process of removing fat in a smooth and natural fashion to get, in my opinion, the best results. The best technique of liposuction, in my opinion, is with tumescence and this liposculpturing that I just mentioned. The gold standard is believed to give the best results when compared to other methods of liposuction. Tumescence is the process of injecting medicated fluid into the areas of unwanted fat. For example, let's say we had unwanted fat in the stomach and love handle area. Medicated fluid, usually containing numbing medicine called lidocaine and epinephrine, are injected into the area to tumesce the area. Liposculpturing is then done to smoothly and naturally remove this fat. This technique that I'm describing is considered the gold standard. To date, there is no other method of liposuction that has been shown to get better results. As a matter of fact, other methods such as laser liposuction have actually been shown to get similar results with increased risks and burning because the laser is heat application. So currently, I don't recommend this procedure, using laser to remove the fat. It sounds like a nice idea, but in my opinion, it leads to increased complications because of the heat. And the best news is liposuction has such excellent results with the techniques that I described, and that's why it's called the gold standard. Now, let's have a hypothetical patient who comes in interested in liposuction. Let's pretend the areas that are bothering the patient is the stomach and the love handle area. I think what is also important is the concept of 360 degrees or circumferential liposuction. What that means is liposuction is going to be done completely around the body in 360 degrees. And it has different names. Lipo 360, circumferential liposuction are the same technique that I'm describing. And the idea is by removing a fat in a circumferential area, you get a better result. Because fat's just not in one spot. It gradually diminishes to the adjoining area. And so the technique of liposculpturing is where you're feathering and contouring and cognizant or aware of these transition areas between, let's say, the stomach and the love handles and off into the back. So by being aware of them, the surgeon can artistically remove the fat to get the smoothest and best results that I just described. So this patient that I just mentioned, or hypothetical patient who wants her stomach and love handle treated, and again, this is a very typical place to get liposuction. The operation takes approximately an hour and a half. I do all my surgery in my state licensed surgery center. I believe it's an extremely safe facility. It's much cleaner than hospitals, and by being state licensed, we have all the safety features of the best facilities. When you wake up, you're in the recovery room, you've been placed into a compression garment, and then you go home. Liposuction is surprisingly easy, in my opinion, to recover from. Not no pain, but there's not an extremely large amount of pain. Most people are surprised. Actually, most of my patients the next day after liposuction are just taking Motrin or Tylenol and not even requiring narcotics. The pain the night of the procedure can have some burning, which is not uncommon, and that is treated with medication that's prescribed. But in general, on a scale of 1 to 10, liposuction pain usually is between a 2 and a 4, and so is considered a relatively easy procedure to recover from. Obviously, it varies a little bit depending on a person's particular pain threshold. Once they go home and they're in their compression garment, the compression garment is worn for a month or sometimes even longer. Showering is allowed in 2 to 3 days. At that point, the garment can be taken off, and the patient's allowed to get a shower. This is a feel-good day because it's always nice to take a shower and get all clean. The garment can be washed and dried at that time, and you can be in a bathrobe as you're doing that, and then you place the garment back on. Activity is gradually increased. Usually I tell patients to take it easy for a week, although many people can resume most activities, jobs and walking, in just 3 to 5 days. After 10 days, you can do anything. The compression garment, however, is still being worn. Risks are low overall for liposuction. It's important to understand that if someone has loose skin, then the results could be different compared to a person who has tight skin. So if you're doing liposuction on a 20-year-old person who's never had a baby and has extra fat in the stomach area, then the skin has good skin elasticity. If you take a 45-year-old woman that's had 3 children and has loose skin in the stomach, then the stomach could have some laxity afterwards, and would have some laxity, and the result might not be as good as if the patient had the tight skin of a 20-year-old. So this is the concept of realistic expectations. Realistic expectations is extremely important. Realistic expectations means that cosmetic surgery doesn't turn us into a supermodel. Cosmetic surgery doesn't turn us into an Instagram model. Cosmetic surgery makes us a better version of ourselves, and it makes us smaller. If we have some laxity of the skin, then usually there's some laxity of the skin after the procedure. If there's some cellulite and some dimpled areas, usually there's some persistence of those conditions, which is important to understand, and the plastic surgeon would describe it as have realistic expectations about the benefits of the liposuction. So I would like to say that this is one of my specialties. I love to perform this procedure. I believe I use the best methods to get rid of and improve unwanted fat. If someone would like to come in for a consultation for liposuction and liposculpturing, please don't hesitate to call the office. I will give a thorough consultation to help you learn what can be done for you and what the operation entails, the recovery, and the risks. And I hope to see you in the office in the near future. Thank you.